This is the Plastic Principle.
Hello, everyone, and welcome to the Plastic Principle podcast. My name is Dr. John Diaz, and I'm so happy that you have joined me today. This is a very special episode, a little bit different than the others. I don't have a guest today, but it is a topic that is incredibly important. And so I wanted to begin by letting you know, in addition to the audio version of this podcast, we also have video of the podcast, which is available on a YouTube channel called the Plastic Principle Podcast. So I really recommend that if there is anyone who is considering breast augmentation for themselves, or if you know someone who is considering having breast augmentation, and if you have any concerns about breast implant illness, this episode will be one of the most important videos or audio that you will ever listen to in your life. So the topic of today's episode will be breast implant illness. And the reason this is so important is because it is a very controversial subject with very passionate people on both sides of this issue. There are people that believe that breast implant illness is a real entity, and then there are groups who do not. And what I want to do today is address all of the issues around breast implant illness and all of the relevant information and data that we have, because it is a big decision for patients to undergo surgery. And it is scary to think that there is something that could happen to you if you choose this procedure. But I want to try to give you as much information as possible. This is something that I do in my consultations. And a lot of the information that I'm going to share today is information that I share with patients during consultations. But I thought it'd be important to now have this kind of memorialized in a format that will be available to anyone anytime. So I really hope that you enjoy this and you get a lot of information for yourself. I think it's going to be incredibly valuable. It is so important to me, this topic, that I actually made notes, and I'm going to have notes here that I might refer to as I go along because I don't want to forget anything. And I've written down the main things that I want to make sure I speak to people about when you listen to this. So before I begin, I just want to tell you some background information. So I have been reaching out to plastic surgeons and other experts for the last couple of months in preparation for this podcast. And I have had already episodes that I've recorded. There are some that have already aired and many, many more that are still being edited that will air soon. And then even more episodes that are planned. I already have the guests scheduled, but we haven't filmed yet. So when you see this episode, there's been a lot of planning beforehand. And the reason I'm saying that is when I was thinking of doing this episode months ago, I reached out to numerous plastic surgeons in the Southern California area. I chose this geographic area because if I did have a guest on, I wanted them to be physically present and not just on Zoom or on audio. I wanted them to be here present with me so that we could have the most engaging conversation possible. So I reached out to several plastic surgeons, and in particular, I reached out to the ones that advertise services or treatments for breast implant illness. So these are plastic surgeons who are promoting their practices and speaking about breast implant illness and removing implants because of breast implant illness. So these are surgeons who are specializing in removing implants for breast implant illness. And I reached out to them because I felt that if I spoke about this subject, I wanted to have a balanced conversation, something fair and reasonable. And I knew that there would be some objection by those surgeons to appear to talk about this and have any kind of counterpoints made to them. So what I said to each of the invitees, I said, if you choose to come on, first of all, I'd be honored. It'd be, I'm happy to have you on as a guest and treat you with the utmost respect. But in addition to that, I will provide you with a copy and a reference to every single article or piece of data that I am going to reference during our conversation, so that you are as prepared as possible to know exactly what I'm going to say, how I'm going to say it, and that you will have the opportunity to therefore prepare yourself and have whatever counterpoint you want to make, and have whatever data you want to use as a counterpoint to the data that I'm going to present. So I thought this was a very fair approach. And not a single one of the surgeons that I invited to appear agreed to appear. Now I want to let that sink in, because I have had already so many plastic surgeons agree to be on this podcast. In fact, I've had already 2 of the world's most famous plastic surgeons appear, and those episodes have aired. So these surgeons are all very busy. Everyone has busy lives. I had 2 of the busiest plastic surgeons in the world who agreed to be here and appear on the podcast with me. So I know it's not scheduling. I know it's not a busy lifestyle. There's a reason they chose not to be on this podcast, even though I extended this very gracious invitation. And I think that after you hear this entire episode, you're going to understand why they wouldn't want to appear. Even though it's a great opportunity for someone to come on, talk about their views, and promote their practice. It would be an incredible way for them to get the word out and have even more exposure of what they do and reach an even wider audience for people who are interested in, removing their implants. It would be a benefit to their practice to appear, and yet they chose not to, even though I offered to provide them with all the information that I had in advance. And I think, as I said, at the end of this episode, you'll understand why. So before we dive really deep into this topic, I thought it'd be important to understand the history of breast implants. And I think this is important because if you understand the history and everything that went on before, it's going to make everything moving forward make a lot more sense. So the modern breast implant was invented in 1961. So breast augmentation has been done for at least 60 years. We've been using silicone-based breast implants in breast augmentation surgery for at least 60 years. And it's only become more and more popular over each decade. And the first versions of these implants had very weak outer shells made of silicone with liquid silicone inside. And these implants were prone to a lot of complications, surgical complications and local associated complications. What I mean by local is complications that are restricted to just the area around the implant. So these implants had a lot of ruptures where the shell would break, a lot of cases where the silicone would leak, it would get into the tissues, it would cause, little problems in those areas. So these issues have been going on for a very, very long time. And the concerns go back all the way back to then. Now, as this was happening, there were occasional studies here and there looking at this issue. But all of this reached kind of a crescendo in the late 1980s and 1990s. And you're going to see how there are so many parallels to what's going on now. So back then, we did not have the internet. We did not have social media, but we did have talk shows. And back then, the major talk shows like Phil Donahue, Oprah Winfrey, Sally Jessy Raphael. These are names that are probably over the heads of a lot of the younger people listening to this. But for my generation, we grew up watching these talk shows. And what happened is they started having these guests on that were talking about the problems they were having with their breast implants. And these talk shows were very sensational. And they would have these patients come on and they would say, I got breast implants. I was a healthy woman before I had the implants. I got the implants and all of a sudden I started having this medical problem and that medical problem. And this happened to me and that happened to me. And they would show pictures and it was extremely dramatic and extremely traumatizing because you would see these, this liquid silicone in the breast and these terrible looking, surgeries, and the pictures from surgery would look horrible and it was scary, and rightfully so. And back then we didn't have great data. So there was a legitimate concern that these implants were causing a problem and we didn't have good answers. This became such a big issue. There was so much media attention around this issue that the FDA finally stepped in the early 1990s and said, enough. we cannot continue allowing breast augmentation if these problems are happening and we don't know what's going on. So they actually put a moratorium on the use of silicone breast implants for cosmetic surgery. A lot of people are shocked when I tell them this. They don't remember this, but I remember very vividly because I was already pursuing a career in medicine and I heard about this and knew about this. So starting in the early 1990s, plastic surgeons could not use silicone breast implants in cosmetic breast surgery because the FDA decided this issue needed to be looked at. And the hysteria that was being created by all of the talk shows and all of the media was becoming a public concern. So they stopped it. And what they did is they initiated a tremendous number of well-funded and well-designed medical studies to look into this issue. And this was organized by the NIH and the Institute of Medicine, the IOM. And they got every relevant specialty involved. And I took a note here because the specialties that were involved included the main things that people were concerned about with breast implant illness. And so they had neurologists. They did a whole series of studies looking at the neurological connection or possible connection between breast implants and BII, breast implant associated or breast implant illness. They looked at the possible effects on pregnancy, breastfeeding, and even on children, because there were some concerns in some of these patients claiming that the implants were hurting the children through the breastfeeding and that their children were having medical problems because of the breast implants. They also looked at oncology, which is the study of cancer, and they wanted to see, is there a link between the breast implants and any of the cancers that these patients were saying they developed as a result of the breast implants. So they looked at the major things that people associate with breast implant illness. And over the course of over a decade, looking at these issues. Oh, and I forgot to mention also autoimmune diseases. So a lot of women who were claiming that after breast implants, they were developing autoimmune diseases like thyroid disease or different skin condition autoimmune diseases, psoriasis, things like that, in addition to all the generalized kind of fatigue and malaise and all of that. So they looked at all of these major categories of the symptoms and the problems that patients were saying were due to the breast implants. And after over 10 years of studies and following patients long-term and looking at the data in very well-funded, well-designed, double-blind, prospective studies, looking at the data carefully, the conclusion was finally published. And it was an almost 1,000-page summary. I think it was maybe almost 700 pages or so, summarizing all of the findings and studies of every single study they did looking at these issues. And the conclusion of every single study done at that time was that there was no link between breast implants, silicone breast implants, and any of these symptoms or diseases that people associated with them. This was published. This is public record. I'm going to, if you're listening, I invite you to go to the YouTube channel and look up the video because I will have links there to these articles and to these summaries, because I think it's important for people to understand that this is not opinion. This is not bias. This is an actual objective conclusion by specialists in fields that are not plastic surgery. And I specifically mention that because a critique I often get when I share this information is that, well, of course you're going to say that. You're a plastic surgeon. It's in your interest to say that. But this was not a publication by plastic surgeons. This was a publication by doctors in other fields. So I think that's a very important thing for people to know that a lot of people are not aware of. It shocks me as about how many people don't know about this. So the conclusion was there was no link. That is the only reason why the FDA allowed breast implants back onto the market in 2006. So before that, you couldn't use a silicone breast implant. It was not until this study came out, these studies and these conclusions came out, that the implants were allowed back on the market. That is the only reason why implants are back on the market. So why is this issue coming back up again? Because us plastic surgeons, we thought it was settled. There was a concern. Silicone breast implants were not allowed to be used for cosmetic reasons. And we studied it, and the conclusions were there is no link. And so we thought the issue was done. But a lot of people are not aware of that. So why is this issue happening again? Well, I think there's 4 things. I think that, in my opinion, what's happened is 4 things have contributed to the fact that this issue has come up again and become an important issue again and a big issue. One is that, remember now, implants were allowed back on the market in the let's say mid to late 2000s. That happens to correspond to a time when this whole eating organic, being green and clean movement started really gaining a tremendous amount of momentum and widespread mainstream adoption. So for a lot of people in this country and around the world, this value being placed on everything being organic and clean and green became very important, a very important part in their lives. So the idea of having a silicone breast implant was extremely kind of contradictory to that type of lifestyle and that type of approach. So that's, I think, one contributing factor. Another contributing factor is the rise of social media and the internet. So I think that what that allowed is that for patients who maybe had problems with their implants, it gave them a platform that you couldn't have before, where they could really speak to large numbers of people very quickly and very easily and share their personal experiences and share their concerns and share their worries. And it reached people very quickly and spread very quickly. The difference was that in the 1980s and 90s, you had to be invited by a talk show host in order to share your story. Well, now you can just share it right on your phone, or right on the internet. So I think that was another contributing factor. The third contributing factor is that there was a problem with the silicone implant. It was the anatomic textured silicone implant that was released in 2013. So this was the original gummy bear breast implant. And when this implant was introduced into the market, it was advertised and marketed as the best implant ever. It was going to reduce capsular contracture rates, create very natural looking results. It was very safe, and it had a great experience in Europe. And so it was promoted very heavily. It was in every magazine. I remember I was in practice already and patients coming in and specifically requesting this gummy bear implant, and it got a lot of attention. Well, it turns out that implant did create problems in the breast. The reason had to do with the texture. When an implant is textured, it has little microscopic bumps on its surface. And the purpose of those microscopic bumps are twofold. One, because the implants had a specific shape built into the implant, the little microscopic bumps prevented the implant from rotating. And they couldn't rotate because they had a specific shape. And so if it rotated, it would throw off the shape of the breast. So in order to reduce the possibility of that, these little microscopic bumps were created to create some friction, and this texture prevented rotation. So that was important. And the other idea was that perhaps the texture could prevent this complication called capsular contracture, which we'll talk about in a little bit. And what it turns out is that those microscopic bumps seem to initiate this inflammatory response in the breast. And as we know, inflammation in the body long-term creates problems. And so it turns out that that very specific implant did create a very serious problem in patients if the implants were in for a long term. And that was a problem called breast implant associated anaplastic large cell lymphoma. It was a very rare cancer. And that obviously is a major issue and a major concern. Now, fortunately, that is extremely rare. It happens in maybe 1 out of 30,000 women. And just to put things in perspective, in the US, the rate of breast cancer is about 1 in 11. So you're talking about an event or the incidence or chance of something happening that is exponentially smaller than the chance of just your normal average woman having breast cancer. Having said that, it's still a big problem because this is elective. You're choosing to put this implant. So we never want to use something that could be potentially causing a problem. So that implant did have a problem. But here's what's really important to understand. It was not the silicone in the implant That's the key piece of information. It's not the silicone that created a problem. In fact, no other type of silicone implant ever created that specific complication. It was the texture. It was this microscopic surface. It was determined to be the cause of this problem. So when that implant came out and that problem was identified, that's when patients said, see, we've been telling you all along that silicone breast implants are a problem and they cause illness. And so I think that reignited the community who believe in breast implant illness and gave them this ammunition to use against breast implants. So I think that was the third contributing factor. And then the last one, the fourth one, is I think people just forgot about what happened, the history. That's why I said history is so important. I think people forgot about what happened in the 1990s. I literally have patients who have no idea that breast implants, silicone breast implants, were not allowed in the 1990s. They have no recollection of that. So not understanding that history has really, I think, hurt people and their understanding of this issue. Because if you knew the history and you knew that breast implants were studied and that these conclusions came out, then this might not have become as big of an issue as it has become now. So I think that's the other thing. People just forgot. People forgot about that this big issue that was resolved back then. So I think that's what brings us to this state now where we are. So let's talk about breast implant illness. So what is this exactly? So breast implant illness is a constellation of symptoms. And we say constellation because it's a great word. It's like the constellation of stars. There are just so many. And I believe there's probably roughly 60, if not more, symptoms that are attributed to breast implant illness. And they kind of cover several categories. So one is local problems. And again, that means problems that are restricted or specific to the area of the breast. So things like capsular contracture. What is capsular contracture? Capsular contracture is a complication in which scar tissue around the implant becomes hard, thickens, and distorts the shape of the breast. Now, scar tissue around the implant is normal. And in any woman walking around with breast implants who has a beautiful, perfect, soft breast, they have a capsule. That's normal. And the capsule usually is very thin and soft, and you can almost see through it. But what's not normal is if it becomes contracted, and that is a problem called capsular contracture. So that is a problem, that is a complication that can happen with breast implants. The other thing that breast implant illness includes are other systemic problems. And by systemic, that means throughout the entire body. And these tend to be divided into three kind of main categories. I would say brain and nervous system complications, pain complications, and autoimmune complications. So brain and nervous system, this means things like brain fog, being tired, just generalized, lack of energy. Also, tingling, weird sensations, stuff like that. So I would put all of that and lump that all into like the brain and nervous system. Then the other one is pain. So there are people who have just kind of generalized pain throughout their body. Their knees hurt, their elbows ache, their bones ache, so on and so forth. So that's another category. And then the third is autoimmune diseases. So people who have developed thyroid disease or psoriasis or Sjogren's, and these are kind of rare, kind of skin-associated types of autoimmune diseases. Those are also attributed to breast or can be a part of breast implant illness, according to the people who believe that breast implant illness is an actual entity. So there are all of these symptoms that people are attributing to the breast implants. And if it's not the breast implant, what is going on? This is the question I get from patients. If it's not the implant, what's going on? And this is what I tell patients. And to understand this, you have to get a little bit of background, basic medical school information. So when I was a medical student, one of the first things we learned, first year of medical school, is that there are diseases that occur in different frequencies, whether you're a man or you're a woman. It's a matter of fact. There are some diseases men get, women don't get. There are diseases women get, men don't get. Just the way it is. And we don't 100% understand why, but most of it is probably due to the difference in the sex organs and the levels of hormones in the body. It's probably what explains it. So what are some examples of this? Well, one thing we know that occurs exponentially more in the women than men is autoimmune diseases. for sure. We learned this in medical school. First year of medical school, we learned this. And I have seen this myself, not only in my professional life, but in my personal life. So professionally, every day when I do consultations, I speak to patients and I get a medical history. I ask them, what medical problems do you have? Every day, at least one or two of my patients who have never had surgery before will tell me that they have an autoimmune disease. And the most common one I hear all the time is thyroid disease. So hypothyroidism, meaning their thyroid doesn't work as well. Very common, very common. I hear it every day, probably at least, once a day, if not every other day. So extremely common to have autoimmune diseases. And it's important to understand that not only does it occur more frequently in women and men, but it also occurs more commonly when women are in their 30s. So these are diseases that tend to appear when a woman is in their 30s or late 30s. Personally, I've known many, many, many friends, female, who have autoimmune diseases, different types, psoriasis, thyroid disease, so on and so forth. So personally and professionally, tons. I personally have never met another man that has an autoimmune disease, thyroid disease, for example. I just don't know it. I'm sure they're out there. I just personally don't know anyone, know any man that has an autoimmune disease. And professionally, other than when I worked in the hospital, I have never met a patient of mine in my practice who's male who has an autoimmune disease. It's just never come up in the medical history. I mean, my male patients, and I have a fair number of them, when I ask them medical history, they'll have hypertension, they'll have, high cholesterol, they'll have, various things, but I just never hear autoimmune disease. So here we have something that is exponentially more common in women than men and occurs in women who, or is diagnosed in women who are in their mid to late 30s usually. Okay, so that's one thing. Another thing we learn that occurs much more frequently in women than men is something called fibromyalgia. Fibromyalgia is this really difficult, kind of nebulous, hard to understand disease that affects, causes kind of like fatigue and joint pain and like discomfort. And it's not well explained. There's no clear pattern. It's very hard to diagnose. But what we do know is that it happens way more often in women than men. Again, I've had over the years numerous female patients tell me they have fibromyalgia. I've never known personally or professionally a male friend or a male patient tell me they have fibromyalgia. I'm sure they're out there. I've never met them. Okay. Last thing, chronic fatigue syndrome. So chronic fatigue syndrome is this also very kind of nebulous, difficult to diagnose, unclear series of symptoms that some patients experience where they feel they're constantly tired, they're lethargic, it's hard for them to get out of bed, they have trouble remembering things sometimes, their brain fog. It's a very uncomfortable and very disruptive thing for someone to have. Same outcome for me. I've had numerous female patients over the years tell me when I asked their medical history that they've been diagnosed or been told they have chronic fatigue syndrome. I have never met a male friend or a male patient who has told me they have chronic fatigue syndrome. Again, I'm sure they're out there. I just never personally met them. So here we have 3 different categories of diseases that are well established, that are known in the medical world, that cause symptoms that and they're diagnosed and found exponentially more in women than men. And if you take these different categories of diseases, autoimmune diseases, chronic fibromyalgia, and chronic fatigue syndrome, all of those symptoms, they overlap exactly with the symptoms of breast implant illness. Exactly. They're the exact same types of symptoms. So these 3 diseases or categories of diseases explain all the symptoms of breast implant illness. Okay, that's a very important thing for you to be aware of. So is it possible that perhaps what these women are experiencing are one of these diseases, autoimmune disease, chronic fatigue syndrome, chronic fibromyalgia? It's something that they would have been diagnosed with anyway, but they're attributing it to the breast implants instead. I want to go into this a little bit further, but for now, I just want to point that out. The other complication that I mentioned, the local one, which is capsular contracture, a lot of people think that's breast implant illness or that's a part of breast implant illness, but it's really not. It's a surgical complication. So when we do surgery, whether it's brain surgery, heart surgery, stomach surgery, colon surgery, whatever it is, and we cut tissues and suture them together, scar tissue is formed. It's inevitable. There's no way around that. And we want that. Scar tissue is important to seal things that we cut. But we know scar can contract. That's just a known thing. It's a side effect or byproduct of surgery. And unfortunately, whether it's breast surgery or heart surgery or colon surgery, scar and contracture of scar can create complications in those areas. This is a known thing. And breast implants are no different. So the complication of a capsular contracture, scar tissue hardening around the breast, has nothing to do with autoimmune disease. It has nothing to do with your body rejecting the implant. It has nothing to do with some systemic reaction of the body to the implant. It is literally a locally restricted, specific complication that is known to happen when tissues are dissected and cut. That's a local surgical complication that has nothing to do with any of the other things we're talking about, but it is sometimes attributed to breast implant illness. So I wanted to point that out because it's something that that really does confuse patients. So what's going on here? So when patients say what's going on, what I say is these patients are, so the people who are claiming they have breast implant illness, the people who are attributing these symptoms to breast implant illness, they are feeling something. They are feeling something. But what they are feeling, the symptoms they're having, it's probably due to one of these three categories of diseases: autoimmune disease, chronic fibromyalgia, or chronic fatigue syndrome. They were going to develop these issues anyway. They happen to have implants, and they're blaming the implants instead because the implants are the perfect scapegoat. It is something they can blame for. Now, why do I believe this? Because if you think about it, this is something we know. Human beings, we want to have an explanation. We want to know why something happened, especially when something bad happens. We want to know why. Why did this happen to me? Whether it's, a personal event or a professional event or a physical event, we want to know, how did this happen? It is the most basic human instinct to know why. Why did this happen to me? And so think about it. You have most patients who get breast augmentation are probably in their early 20s. That's statistically what is most common and what I have found as well in my own practice. So you have a young woman coming in for breast augmentation surgery. And a lot of women, especially in Southern California, they're young, they're healthy, they're fit, they work out, they do yoga, then they meditate, they eat clean and green. They do everything they're supposed to do for their health. And they're living their most healthy, best lives, right? And they get breast augmentation and they're thrilled. They're happy. They can't believe how great this is. And everything is perfect. Now you take that same young woman in her 20s and you start fast forwarding their life. Now they're in their 30s, maybe mid 30s. And all of a sudden, out of the blue, they get a thyroid disease. The first question that's going to go through their mind is, how did this happen to me? Look at me. I'm healthy. I work out. I eat only organic food. I do yoga. I meditate. I do everything for my body. I look incredible. I'm in the best shape of my life. How could I have possibly developed this thyroid disease? And then the light bulb goes off in their head. And they're like, I know what it was. It was those damn implants I got when I was in my early 20s. I think this is what's happening. And there are other reasons that support this, and I'll get into that. But this is probably what's going on. Every day I have patients who come in for consultations, and they're in their 30s. They have an autoimmune disease. They have one of these diseases that we've talked about, and they haven't had implants. And I wonder if they had had their implants in their 20s, would they now be blaming those issues on their implants instead? But they sit here and they're totally fine. And they're like, yeah, I'm diagnosed with this. And they want implants because the fear of the breast implant causing that, it's not there. So I think that's what's happening here is these patients are developing they're definitely feeling something. They're definitely developing symptoms, but they're attributing it to the silicone implants instead of the fact that perhaps, this was something that was going to happen in them anyway. Now, I know this is a very difficult thing to digest. I know a lot of patients who believe in breast implant illness will hear this and be upset by this, but I want to tell you why other things and other evidence supports this theory or this hypothesis I have. And not only myself, but that is shared by many other plastic surgeons. And one of the objections I get, actually one of the first objections I get is, well, how about those people that have breast implant illness, they're feeling terrible and they get the implants on and they feel great, right? Because that's compelling. You have all these stories on the internet, people saying, I got my implants out and now I've never felt better. Okay, that's true, and they probably do. But there is an explanation for that. And it has to do with the placebo effect. So I think everyone has heard about what the placebo effect is. It's basically when you think something can help you and you take it, it will make you feel better. And that's been proven. There's countless scientific studies that have proven that this effect works. And we are taught this in medical school. And I have personally seen it in my own life and practice, and professionally and personally. In fact, I often share this story. When I was a resident in surgery, one of the things that happens when you're a surgical resident and you work in the surgery department is that occasionally patients will come into the emergency room and they'll be writhing in pain and they'll say, I have this tremendous abdominal pain and I'm dying. And you see this patient and they look like they're about to die, and it's scary. And you do all the blood work and lab work, and you do ultrasound, you do CAT scan, and you do ultrasound, you do all and everything comes back negative. And you can't figure out why this patient is in so much pain and saying that they feel like their abdomen is going to burst. So we saw patients like that. And the problem is you can't let that patient, if they're in the emergency room and they're saying this and you don't know what's going on, you can't let them out of the hospital until you get it under control, because God forbid, what if you miss something, right? So we would admit these patients to the hospital and we'd follow them. And they'd be on the floor of one of the surgery floors, and we'd be examining the patients every day, and they're still saying, I'm in so much pain. I have this, and we'd be giving them different medicines for pain and antibiotics and this and that, just trying to figure out what's going on. And there would be nothing. There would be absolutely nothing. And I'll never forget one of the senior surgeons who was in charge of this group of patients. This patient was part of his, patient group. And we kind of had run out of options. And what he said was, look at this, let's do this. And he sent us to get a bag of saline, salt water. So an IV bag of salt water, plain salt water. And he went to the patient and he said, happened to be a female patient. And he said, Mrs. So-and-so, I'm so sorry you've been having this problem. I think we finally have a solution. And then he went into this elaborate story about how he's gotten his hand on this very experimental drug that he shouldn't even be giving it to her because it's so special and it's just come out and it's a super expensive drug and it is, used for the most severe of severe cases, but he's going to make an exception and use it on her. And he creates this elaborate story and this elaborate process. And then we bring in then he asked us to bring in the IV fluid, and we bring it in this kind of almost ceremonial way. And he had us put some colorful labels on the bag. We put the IV in, we ran the IV, and I kid you not, an hour later, the patient told us she was cured. Okay. Now I share that with you to tell you how powerful the placebo effect is. And it turns out, I didn't know it at the time, but I later looked this up, and there's an incredible article in one of the world's most prestigious journals called the New England Journal of Medicine, where they looked into this placebo effect and really broke it down into its component parts. And one of the things that is very powerful about the placebo effect, or what makes it really powerful, is if the patient thinks it's going to help them, that's one thing. But the more elaborate the treatment is, the more involved the treatment is, the more powerful the effect is. So what does that mean? That means that if you tell a patient, hey, rub this cream on you and it's going to make you better, it might work, but the effect will be kind of weak. It won't be a strong effect. If you now tell the patient, take this pill, okay, that's going to be a little bit more powerful because now they're taking something into their body. Okay. If you now put an IV, right, way more powerful, way more powerful. Now they're sticking a needle in the arm. There's this tubing. There's a bag that they're looking at. Much more powerful effect than just a cream or a pill. But what's the most elaborate thing we do in medicine? What is the most elaborate process in treatment we do in medicine? It is surgery. It is surgery. So of all the treatments that can be the most powerful placebo effect, it's surgery. Now, here's what's important to understand. I've been talking about something where people think that they're going to get something and make them feel better. But that's not happening with breast implants. It's the opposite. They have something in them that they think is hurting them and they're taking it out. Well, the placebo effect has its opposite effect called the nocebo effect or the negative placebo effect. And it's the same thing. Instead, in reverse, if someone thinks something is hurting them and they take it out, they're going to feel better. And the more elaborate that process of taking it out is, the more powerful the effect is. And again, what is more powerful than that patient having to go to a doctor? More elaborate process than that patient having to go to the doctor, go through a consultation, schedule a surgery, pay for the surgery, plan for it, recovery, have people take care of them, and then undergo the surgery and under anesthesia and all that. What is more elaborate? What is a more elaborate process than that? There is nothing more elaborate than that. And that is why the effect is so powerful. That is why these people, this is a known thing, when patients have their implants taken out, they will literally tell you 30 minutes later in the recovery room that they no longer feel the symptoms they were feeling. Now, you don't have to be a doctor or surgeon to understand that is medically impossible. There's nothing that works that fast, okay, in terms of removing a device or something like that. So that is the negative placebo effect in action. Now, the other reason we know this is because they've done studies, long-term studies, where they look at those patients and follow them for over a year. And those patients will come back a year later and they'll have symptoms that are very similar to the symptoms they had before the implants were removed that they were attributing to the implants. I also personally, professionally in my practice have seen this. I've had patients over the years, patients of mine who asked their implants to be removed and patients from other surgeons who had their implants removed, come to me years later and say, I want my implants back in. And I'm always a little bit shocked because they had them removed for breast implant illness. And they'll tell me, you know what? I realized it wasn't the implant because everything I was feeling when I had the implants that I thought were the implants, it all came back. And so now I'd rather have my breasts the way they were and deal with the symptoms than deal with the symptoms that I have anyway and not have implants. So I think that's a really important thing for people to understand. The other objection I get sometimes is people will tell me, well, how about these studies that show that there are these toxic chemicals and these antigens in the blood and those are found more in people with breast implant illness than not? Well, it's important to understand that the quality of the studies is very important. And I can tell you that there are no high quality, double-blind, this is like the gold standard, double-blind prospective studies showing that there is an actual causation. Now, causation means that you identify something that can be a problem and you actually prove that it is the thing causing the problem. Instead, most of the studies on breast implant illness that are out there are correlations. They find antigens in the blood and they say, oh, this seems to be higher in these patients and therefore that explains breast implant illness. Or there are more toxic chemicals, or there are these toxins in the blood we found, there's silicone particles or silicone molecules, and that's why they have breast implant illness. Well, that's not a well-designed study. That just means there's a correlation that explains, that could explain it, but it's not proving anything. It's not causation. This is very similar to all of the best analogy I can give you is if you think of all the nutrition things that come out. For example, you just listen to some of these health shows or whatever, and they'll say, if you eat 10 goji berries a day, you're going to be better because the studies show that people who eat goji berries, have less cardiovascular disease or whatever it is. You can pick whatever. And, maybe there is a study that shows that people who eat goji berries have less cardiovascular disease. But that doesn't prove anything. All that proves is people who eat goji berries also tend not to have a lot of cardiovascular disease. But it could be any other things that are actually the reason why that person doesn't have cardiovascular disease. For example, maybe the people who eat more goji berries eat more fruit in general. And people who eat more fruit in general tend to be healthier and probably, prioritize eating healthy and exercising and things like that. And perhaps that's the real reason why they don't have as much cardiovascular disease. So it's very important to understand that the quality of the study has a big thing to do, big influence on whether or not we can take that study and really believe its conclusions. And none of those studies that support breast implants so far, none of them have been of that high quality study that would really show causation. Now, the other thing I want to point out, because as I just said in objections, people say, well, this person on TikTok or whatever said that people with breast implants have higher amounts of silicone in their blood or higher amounts of this chemical in their blood and blah, blah, blah. And that's, obviously concerning. Of course, who wants that in their blood? And so that's another thing that people are always saying is so negative about breast implants, right? But then I always remind people, well, wait a second. You're not remembering or you're not keeping in mind all of the other things that patients do that probably put as many molecules and toxins in your blood that silicone implants do or more. And no one talks about no one talks about illnesses related to that. So let me give you some examples. So sometimes people think that a saline implant is going to be much healthier than a silicone implant. And they're not worried about saline implants. But saline implants have a shell of silicone. So it's the same shell that a silicone implant has. It's just filled with salt water. But a lot of people will believe that saline implants won't cause breast implant illness, but silicone breast implants will, even though the shell and the material is almost exactly the same and it's going to have the same effects on the body. But there are many, many other devices that are put in the body that that have silicone that no one ever attributes any illness to. So for example, pacemakers, okay? Heart valves, cochlear implants for the ear and hearing, hydrocephalus shunts. So these are patients who are born with a problem of draining fluid from their brain. They have to have these tubes that go from the skull down into their intra-abdominal cavity to drain the fluid. Those things are made of silicone. Feeding tubes are made of silicone. There are lenses for the eyes that are made of silicone. There are a multitude of devices that have silicone in them that are in patients permanently or for a very long time. And no one ever seems to complain about any implant illness associated with those things. So that's an interesting observation to make. The other thing I want to mention is how about all of the other, let's say, not medical things that people do that are putting also different chemicals in their body. For example, tattoos. I have so many patients who tell me they're worried about breast implant illness but have tattoos. Well, tons of studies have shown that when you have tattoos, there's pigment that is being implanted into your skin and absorbed into your bloodstream. And there are tons of studies that show these chemicals in the blood. And there have been studies that show a correlation between some tattoos and different conditions and diseases in the body. For example, we know about skin infections. That's a known thing, but that's a complication. That's a local complication from the injection. Hepatitis C is a viral infection, very serious infection that can happen from tattoos, okay? But studies have proven that 60 to 90% of the pigment that is tattooed into the skin is absorbed into the blood. And studies have shown that this pigment can appear in cells throughout the whole body and organs throughout the whole body. In fact, they concentrate the pigment, concentrated amounts of tattoo pigment have been found in the liver. This has been proven. And there are also reports where they have correlated some tattoos with cancer. So here's something that a lot of people do that have the same, if not more, studies showing molecules and other kind of things in the blood, but no one talks about illness related to that. How about hair dyes? So a lot of patients get their hair dyed, different color. Those chemicals are absorbed by the scalp and into the bloodstream. And there are numerous studies that you can go on and look up that also show some correlation between those hair dyes and some diseases and cancers. But no one ever talks about hair dye illness. No one ever, it doesn't receive the same worry or attention, even though there are probably, if anything, more studies about that. Hair straightener. I'm sure a lot of patients out there have heard about this. So hair straighteners, to make the hair straighter, have very powerful chemicals in them to allow this hair to get straightened. Well, those also get absorbed by the scalp and get into the bloodstream. And studies show that these molecules are in the bloodstream. You can measure them. And I know hair straighteners have changed. There used to be worse ingredients in the past. Now a lot of them are made safer, but still not perfectly safe. And there are studies that show that those chemicals that are being used to straighten the hair, even the so-called safe ones, are found in the blood. And there have been studies that have linked it to uterine cancer, breast cancer, and kidney disease. Okay. But that's not all. How about tanning sprays? So many women go into tanning booths and get sprayed, right? Well, those are chemicals. And there's a chemical in particular called DHA, which is highly absorbed by the body and breathed in. Okay, it goes into the lungs. And there are studies that have shown that DHA and other chemicals that are in spray tanning solutions can cause disruptions in the cell function, especially in the bronchioles of the lungs and the trachea, which is the breathing tube of the throat. And that perhaps there have been studies that show some possible link to cancer. Okay, and again, that applies for options that are so-called safe. So, there have been a lot of marketing for these things that are safe version, but the studies show that those chemicals get absorbed into the blood just the same. Okay. So no one talks about those. No one talks about any of those things leading to some type of illness. And it's done widespread, and it doesn't receive the controversy and the social media attention that breast implants do. One last very important observation I want to make. When I heard about breast implant illness, and the attention it was getting in the late 2000s, early 2000s, and I was hearing about it, I got concerned because here I was as a plastic surgeon putting in breast implants. I wanted to know if this was true or not. And that's when I reviewed the studies from the 1990s and the conclusion in 2006 by the FDA allowing breast implants on the market. And I looked at the studies, and I felt confident as a surgeon that there was really no scientific link. But in order to appease myself and to better inform and educate myself, I went online and I read a lot of the stories of women with breast implant illness just to understand what they were saying. And it was heartbreaking. I heard these women speak about all these things that were happening to them, and it's terrible. It's terrible. They were feeling, they were having problems. But I noticed something, and I kept looking up more and more sites, blogs at the time. Blogs were really popular, looking at blogs from patients who said they had breast implant illness. And I must have looked at hundreds, if not maybe almost 1,000 of these accounts. And I spent probably a good 2 to 3 months reading as many of these personal stories as I could. And I noticed a very important fact. And not one of those blogs and not one of those stories were from patients who received breast implants after breast cancer reconstruction. So this is super important to understand. Women that get breast implants, silicone breast implants, there are 2 types of surgeries where women get breast implants. One is for cosmetic reasons. So this is a perfectly healthy woman. Nothing's wrong with her breast. She's just electing and choosing to have an implant placed in for cosmetic reasons. And then you have patients who have had breast cancer. And because of the breast cancer, they have to have their breast tissue removed. And now they're left with a missing breast, or a breast that is severely different than the other breast. And that is a very disturbing and a very difficult position for a woman to be in. And in those cases, the breast is reconstructed, and it's often reconstructed with a silicone breast implant. Every year, approximately 150,000 women undergo breast reconstruction with silicone breast implants. Every year, 150,000. At this point in time, there are probably millions of women walking around with silicone breast implants after breast reconstruction for cancer. I personally never saw one blog or one social media post from a patient who had an implant for that reason, complaining about breast implant illness. How can that be possible? How can it be possible that millions of women with silicone breast implants that had it for breast cancer do not complain about breast implant illness, but women that got it for cosmetic reasons do? Now, I'm going to backtrack and just say that maybe there are out there. There might be. Maybe I missed a blog or I missed someone's social media account. Maybe there's a woman who had silicone breast implants for breast reconstruction after cancer and does say that they have breast implant illness. Maybe they're out there. I'm just saying that I personally, over 2 to 3 months of reading blogs and social media accounts and stories, never came across one. And to this day in my practice, and I see a lot of patients for breast surgery, not one of them asking to have their implants removed had implants because of breast cancer and breast reconstruction. Now, you don't have to believe me because I'm just one surgeon, and this is considered anecdotal evidence. So that means it's just an anecdote. It's a story. It's my story. But guess what? There are studies that have proven this too. So there's at least one study out there that looked at women with breast cancer and reconstruction with silicone implants. And they followed these women and they looked at their symptoms and they found that there is no increased reporting or difference in the symptoms that are attributed to breast implant illness in these patients. And they compared these women to control, which means women who didn't have breast cancer and didn't have silicone implants. And the symptoms of chronic fatigue, brain fog, feeling tired, so on and so forth, were the same. So there was no increased reporting of these symptoms in women with silicone breast implants from breast cancer reconstruction versus women just in the general public who have never had silicone breast implants. I think that is a very powerful piece of information that is not often shared, that a lot of people are not aware of, that I think you should really think about very deeply why that exists. I have my theory. My theory is that when women get breast implants for cosmetic reasons, there may be a very small feeling of guilt that perhaps they shouldn't be doing this. Now, why do I think that? Because I hear that sometimes in my consultations. I'll have patients who will say, I can't even believe I'm here. My breasts are great. Everyone tells me my breasts are great. I literally hear the words, I feel guilty even thinking about this. But they want to, and they do it, and they're happy. But I wonder what happens, if 10 years later they get a thyroid disease or they get another autoimmune disease. They might feel guilty about it. Just like I said earlier, they might look back and say, how did this happen to me? I know what it was. It must have been those damn implants I should have never gotten. I think that's what's happening here. I think these patients are feeling something. They're getting problems. They're having a symptom maybe from autoimmune disease or chronic fibromyalgia or chronic fatigue syndrome. They want to make sense of the world. How did this happen to me, even though I've lived so healthy and I've had such a healthy lifestyle? And the breast implants are a very easy thing to blame. I also want to add that I have many patients who tell me, well, I went to my general doctor and he agrees with me that it's my breast implant. I can explain that as well. As a plastic surgeon, I often have older patients who are coming for facial procedures, and we need to send them to doctors for medical clearance. Okay, that means they have to go to a primary or general doctor to look at them and say, well, your heart's in good function, your lungs are in good function, your kidneys are in good function, and you're okay to have surgery. And they write a letter saying the patient's medically cleared for surgery. This is a very standard routine thing in surgery. I can't tell you how many patients over the years have come back to me and told me, wow, it was really hard for me to get this medical clearance from my doctor. They tried to talk me out of cosmetic surgery, okay? And these are patients, maybe in their 50s or 60s who want to get a facelift. And they're like, my doctor sat there with me for 15 minutes and was trying to talk me out of getting a facelift. And I finally said, hey, doc, I get it. I know you don't want me to get a facelift, but I want to get a facelift. So do the damn medical clearance. So why am I sharing that? Because the general medical community, outside of plastic surgeons, a lot of them aren't fond of plastic surgery. They don't understand what plastic surgery is. They don't get it. And they're just like the regular public that have the stereotypes and believe the misconceptions and myths of plastic surgery. And also, their priority is the patient's health, and they're thinking, well, why are you going to do this procedure? You don't need it. It's, they're used to prescribing medications or, recommending surgery to remove tumors or whatever it is. So for them, this doesn't make sense for someone to get cosmetic surgery. So it's important to understand that the general medical community already has a bias against plastic surgery. So that's number one. Number two, another thing about doctors is we hate not knowing the answers. We hate it. It's not who we are. That's why we became doctors, because we are fascinated by the body. We want to understand it. We want to know it. And I can tell you right now, nothing gives us more satisfaction than diagnosing something, looking at something, and knowing how to fix it, whether it's high blood pressure or, for me, someone who is unhappy about the appearance of their breasts or their face, okay? We love solving problems. We love having a solution. So when a patient comes to a doctor's office and they're saying, I feel tired all the time. I don't know why. I never used to feel this way, doc, and I eat green and I eat organic and I work out and I exercise. I just can't explain it. I don't know what it is. And the doctor says, sure, let's order some lab work. And they do the blood work and then all the tests come back normal. Now the doctor's stumped. Maybe he was hoping to find something in the lab work. There's nothing in the lab work. The doctor's stumped. They don't want to say to the patient, I don't know what it is. That's not a great feeling for a doctor. They want to give the patient an answer. And so if a patient says, doc, do you think it could be my implants? The temptation is, it's so easy for a doctor to say, that it could be. You're right. Maybe that's what it is. Because the alternative, which is to spend, remember, these doctors, sometimes they have 5 or 10 minutes with a patient. And if they ordered tests and they ordered an x-ray and they ordered this test and all of it comes back negative, it's so much easier for them to say, it could be your implants and maybe that's what it is. It's so much easier for them to do that than to sit down and to try to go through the checklist that diagnosing chronic fibromyalgia would need, or chronic fatigue syndrome, or some of the other very obscure, very rare autoimmune diseases. That's a lot more work. So I suspect that in a lot of those cases, it's just the doctors mean well. They want to help the patient. They try, they order all the right tests, but at some point they have to move on to the next patient. And it's so much easier to agree with the patient and say, yes, it's probably your breast implants. So I think that's what's going on in that last situation. So putting this all together, how do we make sense of this? I think what's going on is these patients are getting breast implants in their early 20s, mid 20s, before the diagnosis of these other things happen. A lot of patients today live a healthy lifestyle. They exercise, they eat well, they work out, they do yoga, meditation, they do all the things we're told to improve our lives, maintain our health, and improve longevity. And 10 years go by, now patients are in the mid 30s, late 30s, and they're diagnosed with something, or they have symptoms they can't explain. And the easiest culprit to blame is the breast implants. So these patients are feeling something, but everything that we have, all the knowledge we have, all the studies we have, from the conclusions from 2006, that summary of 10 years worth of data, to all the studies now, nothing has been able to prove that breast implants cause any illness. So that's why most of us plastic surgeons feel confident performing breast augmentation on patients, because we believe, based on all the evidence we have, that there is absolutely no link. I want to say a couple more things. There are many great plastic surgeons all around the world. I'd like to consider myself one of them. And I promise you, I guarantee you, that if any of us leaders in plastic surgery thought that breast implants were causing an illness, I promise you we would be the first ones to step in and look at this and figure it out. Just like we did back in the 1990s, just like we did with those studies. We would want to know. And just like I did when I researched the blog posts and the social media, trying to find, is there something I was missing? I promise you, good plastic surgeons, the leaders of our field, if we thought there was a problem, we would be the first ones to try to look into this and solve it. It's why, going back to the beginning of this podcast, it is why when I invited these various surgeons throughout Los Angeles and outside to appear on this podcast, and I gave them the opportunity to give me a counter to all of the arguments I was making today, I believe that's why none of them accepted my invitation. It's not because they believe in breast implant illness. It's because they know that they don't have any data or studies that can contradict what I am saying today. I implore you, I beg you to think carefully about everything I've said today. Really consider what I've said, all of the evidence I've presented, and all of the explanations I've given, and really let that sink in. Why wouldn't a surgeon who believes in breast implant illness and is encouraging his patients or her patients to get their implants out, why wouldn't they want to come on and defend that and promote their practice? And I think we know why. So with that, I just want to say this has been a long podcast. I hope that it was helpful. I hope that it provided a lot of information for you and answered a lot of questions. I tried to address all of the major myths and misconceptions and the contradictions that patients hear about breast implants. And I hope that you were able to get something out of this and that it helps you or someone you know on their journey to making a decision about whether to have surgery or not. And I invite you to continue listening and submitting any questions if you have them. I'm always here to help patients and answer questions and provide more insight into this world of plastic surgery and everything that it comes with. So I hope you enjoyed it, and I look forward to speaking to you again soon.
This is the Plastic Principle.